Good morning, and today is Thursday, March 3rd, 2022. I'd like to welcome everyone to our COVID update, weekly COVID update. Remember to keep everything friendly, and look forward to your questions shortly. You give the update on our total active positive cases for below Alonso. As of March 3rd, we are at 0. Everyone give yourselves applause on the back. Doing good work. Still using our masks and hand washing and social distance. I'd like to keep that number at 0. Our total new positive cases for Sinai between February 21st and February 27th is also 0. It's excellent. We're on a roll. I'd like to keep it that way. And our total positive cases since November of 2020 comes up to 216. That's great. Total recovered cases as of March 3rd is 214. So that's really good news. We are seeing the state of New Mexico had about 440 cases, positive tests yesterday. Their total so far for total positive cases is 512,550. That's for the state. And then for current new deaths, we're looking at 16 people, unfortunately, that did pass from COVID. And as of today, we have 236 people who are hospitalized with COVID-19. So it is good that we're seeing the numbers trend down. The virus is still out there, so we do need folks to remain vigilant, remain true to your habits, and hopefully we will see a day when we won't have to worry so much about masking and staying distant from each other. And I would like to hand off the talk to LaDawn. Hear me okay?
Can you hear me now? Okay, just a couple. Okay, so I was just saying that as my slides are still uploading here, what I did was I gathered information that's shared from the New Mexico Department of Public Health. And so I found it interesting that we have information available to us, but it's really difficult to disseminate or share this information because, taking a look at the data, we see an upward trend of over the course of a few months. And this is just New Mexico data. Sorry, it's still processing. But really, the information that we receive here at the Health and Human Services is we get a total of cases across the state, and then we also get a total of the new cases across the state, as well as information across the counties. And so I was focused on Santa Fe County, and there's just, the total cases are trending upward. And well, they according to the data, the total cases trend upwards. And we want to say that it's because of the variant and the changes. There's a lot of changes taking place as far as, within the recent weeks is the mask mandate that has changed. And so that changes quite a few things, and it puts a lot of information out there to wonder, okay, are the cases going to go up? And then also we're being provided with home tests. Are people reporting their home tests? And so that's the question we look at when we're provided, data. And so we look at the trends, and I can see it's still loading here, but really this data starts from January to February. We have recent updates yesterday, but I didn't include that in this presentation. But really, I also identified the weeks after we had breaks. So we had in January, we had Martin Luther King. So that may have made some, you may see some changes in the data that I'm hopefully going to share if it uploads. And then also feast weekend, that also changes across the board for Santa Fe County. And then as well as the changes with when home test kits were implemented, and then also the Super Bowl weekend. So those are also information that we're going to identify. Are you able to see my PowerPoint? No. Okay. It's still not. Okay. So that's really what I gathered, and I'm not able to. Okay, there we go. Great. So here we go. So as mentioned, here we have our the information I mentioned from the New Mexico Department of Public Health. And so information from January to February. How do I move? Next slide. Okay.
You have to click on
The document in my.
Yeah, there you go.
Okay, here we go. And so here we're. Sorry.
It's not your fault.
So the screen that'll come up, the total COVID cases will show an upward trend. It shows that from January 11th, when we started getting data from the New Mexico Department of Health, the trend was slightly moving upward. So we were in an upward trend. And as we head into about February 16th, that trend kind of just tapers. And it just continues to move in that manner. So we're kind of at a standstill. And so that's information. We're really not seeing too much of a change right now. So we're at a snail's pace here. We're moving in a direction to where we're not seeing cases going up across the state. So this is information across the state, and so we're doing well, but we want to make sure that we're continuing to be cautious of what we're doing, our habits. We want to make sure that we're washing our hands. We want to make sure that we're aware of those individuals who may be immunocompromised. Those individuals, we want to make sure that we're taking care of them and keeping an eye out and being cautious there. So let me go to the next slide. Yeah, sorry, it's just not working on our end.
That's PowerPoint, that's a problem.
Oh, I see. I did that last time. I provided it in a PowerPoint. Okay.
We have some technical support here.
Thank you. So we are on the third slide. Thank you. So here we have COVID cases, the new COVID cases over, as mentioned, the beginning of January. We see January 11th, that trend kind of moves upward. And so these are the new cases reported, but the outlier, and that's the time frame between January 22nd and the 24th, that's an outlier that was really information collected over those 3 days. We have two outliers on this, the case information here, but as you can see, the new cases, they're kind of trending down. So if you look down at the bottom at 225.22 recently, the most recent data, we see there's indication that the new cases are at a reduced trend. And next slide. Okay, and so this slide is something I was looking at, just information that I gathered and was able to identify a few things. So first of all, these are the COVID cases in Santa Fe County. So really pulling out those important weekends. There's one weekend that's not in there, the week after Martin Luther King weekend, the 3-day weekend, that was January 17th. You can see the 19th, there wasn't really information to identify the cases in Santa Fe County. But feast weekend, a lot of the cases after the feast weekend, the cases went up in Santa Fe County. So that's, it could be a contribution to why the cases went up the 24th. We wouldn't be able to identify that, but that's just information out there that I want to share. And then we move over to February 28th. This is the time after home tests were being distributed, the start of home tests being distributed. A lot of the cases, quite a few cases went down. Maybe it's because people aren't reporting, or they're realizing they don't have to go in to get tested. They're testing themselves at home. But as you look over to Super Bowl weekend, that trend moves upward, and you see how the cases went back up after the Super Bowl weekend. And then as we move over toward the end, after February 17th, that's when New Mexico lifted their mask mandate. And then also we got to keep in mind that home test kits were being distributed. So the data there is going to be, it's really something I wanted to share, is we're not going to have really conclusive data going forward. I feel like we're going to have those questionable, we're going to have questionable information about reported cases. And then also we're going to be impacted with the mask mandate. That's really all I really wanted to share right now. Maybe we have questions, concerns, but really those are things I wanted to share. Sorry about the PowerPoint. So, but Yeah, if you have any questions, we have, you can comment, you can leave us there with questions. If you have concerns, you're also welcome to reach out. But
Thanks, I really appreciate that. It's good to have a visualization of what we've been going through and so people can see the impact of some of those holiday weekends.
Can I add something? Hi, everybody. Sorry. I wanted to talk about the reporting part. There's a lot of people out there that have home test kits that are they're testing themselves at home and they're not making their test results known. Now we don't want to have to push to have those numbers added to the state number, the state repository, but we would like to know and with the COVID response team so we can kind of help you guys navigate that process. There are folks that are probably testing at home with test kits that are not reporting their tests, and that's we don't have to have that as part of the state numbers, but we should have them as part of the public's understanding of what the virus looks like in the community. So I just wanted to throw that out there. If you have home test kits and you are testing yourselves at home, please notify one of us, call the COVID hotline, and let us know that you tested positive so that we can help. So that's all I wanted to add.
I think this is Raylene. Good morning, everybody. I would like to include that as well. The Pueblo is still under an executive order that was updated or modified prior to feast, and so that executive order is still in effect here in the community. So as you may have saw on the news yesterday, the CDC has made numerous changes, I would say within the last time we were here. But the state of New Mexico has also not made any changes as far as contact tracing or abolishing contact tracing case investigation. So, just be mindful that whatever the state does doesn't necessarily reflect what the Pueblo is doing. So just keep in mind that we still, or for those of you that do live here in the community, you are to abide by what the governor and administration puts forward. Thank you.
So Rebecca got booted for some reason, and so she's trying to log back in. I don't know what's going on there. The other thing, a continuation of what Raylene was just now saying is that, as long as the numbers stay low and we continue to monitor the case counts in the community, there is talk at this particular moment of changing the executive order. So there are going to be some potential updates, probably towards the end of March. No guarantees, but as long as the numbers continue to stay down, we can expect there to be some lifted restrictions in the community. But the law and the guidance that the community has to follow is the current executive order. So I don't know where she's still down.
yeah, we're working out the kinks. Troy didn't say he was not in the office, so we're kind of running the show here. We really appreciate everyone coming. Well, those of you that are joining us, we're doing our best to make sure we're providing you with information, making sure that you're aware of what's going on within the Pueblo. But yeah, as Raylene mentioned, the information that I share doesn't really reflect what's going on in this community in the Pueblo. So we want to be cautious but that's the data collected. We have been keeping track of what's going on in the Pueblo and how we've been trying to implement the processes going forward, making sure that we're following guidelines, that we're taking bits and pieces of what the federal government or CDC shares. We try to implement that and break that down into manageable pieces for the community. It's a little bit difficult when we try to go from explaining or trying to break down the rules, the policies, the regulations, and trying to implement them so that they're safe and they're culturally appropriate for the community. I feel that's really important. And then sometimes we don't take into consideration the lifestyles that are here on the reservations. So yeah, I just want to share what's going on really in Santa Fe, but also just to give you an idea of what we're doing on our end to give you information and to keep things up to date.
And LaDon, you make a good point. It's important that we are in Santa Fe County. The Santa Fe County numbers and transmission rates do apply for what we do here. So what you shared is absolutely important, because the county numbers will affect the Pueblo. The state numbers can affect the Pueblo. So that's what you have to take into consideration when listening to the information that was presented, because it is relevant. Just because we don't have cases in the community right now does not mean it's not floating around down 502 and down 30 and in Los Alamos and Rio Arriba County and Santa Fe. And those are all the places that we go shopping at. We go to Smith's, we go to Walmart, we go to all the different places, and that's where a lot of the transmission can happen and be brought back into the community. So making sure we understand those numbers is important. Sorry, Rebecca, you're back, so I'll back off. Rebecca, you're muted.
Hello there. Thank you for bearing with us while I had some technical difficulties in my computer. And I really appreciate Troy helping me out there, and LaDon as well, and really everyone. It's been great. Just want to go over really quickly some of the information that's current. As far as vaccines, they're not currently doing any mass vaccine clinics. Nothing scheduled right now. You can still get vaccinated by appointment. IHS, the phone number is 505-946-9203. Call and make an appointment. We do encourage everyone to get vaccinated and boosted. For testing, we are doing appointment only rapid testing here on the Pueblo. Buffalo Thunder, we're still doing the referrals that are required, so please contact us. And IHS also by appointment only. That's the same number at 505-946-9203. They are Monday through Friday, 8 to 4:30. Our COVID hotline, 505-252-5986. We're available by that phone number Monday through Friday from 8 to 5. We do use it for on-call on weekends. And you'll want to also use that number when you're coming to our building and get tested to let us know that you're here so we can receive you in a safe and friendly environment. Please don't just come through the door, especially if you're needing to be tested for COVID. We want to keep everyone safe and everyone moving along for that. So I see there are questions, and none through CDC is in the works about getting children vaccinated. Yes. Okay, and So the FDA is still currently reviewing the data, so there isn't quite a decision made yet. But I know that they will make a decision soon. They recognize the importance of protecting small children from this virus and how it can impact them. So that's a great question. Thank you, Princess. Any other questions, concerns? I'd also like to open up the question comments for folks have ideas of things they'd like to see us talk about in health and nutrition in the future. Can't guarantee anything, but we'd love to hear from you.
Can I add something?
Of course.
I did want to let the community know also that we'll look out for the new vaccine that's actually being evaluated by the FDA, the Novavax vaccine. So it'll make a fourth vaccine available for folks in the United States. The vaccination rates have been declining, interest has been declining, but we do want to remind everyone that as we approach the fall season, when the flu season and respiratory illness season comes back into play, we do have to be cognizant that COVID may make a return. So vaccinations are still important. So watch out for that new vaccine option, as well as seeking out the current vaccine options that are available. Just wanted to put that out there because there are some vaccines changes in vaccines coming soon.
Yeah, it's still really important to get your vaccines, folks. We'll try to keep you abreast of any new details that we come across, especially any new vaccines, any availability changes as far as additional doses or boosters. We want everyone to have the opportunity to try to stay ahead of this virus while we're having a lull. I know that we've seen this before, where things have seemed to return to normal, but we can't make any assumptions. We all want to stay healthy and stay safe, and so you always want to proceed with abundance of caution and just be aware of the things around you. If you see somebody that may appear sick, or if you or someone in your household that may not be feeling well, make sure that we're still asking all the good questions and getting follow-ups with our doctors and whatnot. Still want to stay ahead of that with hand washing and sanitizing surfaces and all of those really good healthy habits that we should do all the time.
So as we wait comments and questions, how's everybody's day going?
So far, it's been good.
Yeah.
Yep.
We have 5 viewers on, and they are probably just waiting for an opportunity to jump in. So we're going to give it to them. Come on, folks. If you have questions, comments, concerns, anything about COVID, anything about anything health and human services related, it will be great to answer your questions right now.
This is Raylene. I have some things to share about HHS. So I wanted to share with the community that the education program is hosting a spring break camp, I guess you can call it, next week. The Milwaukee schools are on a spring break next week, and it'll be held from Monday through Thursday. You can contact the Learning Center for additional information, and the number there is 505-455-2635. If you would like to send your children over there, there is a age limit, and there is, I believe, a capacity limit. HHS will be doing some presentations or sessions with the kids there, so we hope to see many of the kids. I also want to point out that today, this afternoon at 2 p.m., will be the second day of our walking group. So we have restarted the Walk for Wellness for the spring. So we hope to see many new individuals come out at 2 o'clock. We meet at the baseball field and we walk for about half an hour. I also would like for you all to save the date. We are having a event on March 17th for National Nutrition Month. It will be held virtually and in person. It'll be held at the El Rancho property, and it'll start at 11 and it will run until 1:30 p.m. and lunch will be provided. And so if you do attend virtually, you do have the option of going by the club and picking up your lunch and heading on out. We'll also be having a drawing that day. So anybody that attends virtually, they will also be included in the drawing. Also, if you would like to attend in person, you can contact me directly at 505-660-8927, and I can go ahead and sign you up to attend in person. I am hoping that we will have a good number of people that will attend, and I'm looking forward and the community coming out to meet our CDC workers, which is Rebecca, LaDon, and our nutritionist is on contract, Sarah Fallion. So we'll be out there, and I hope to see many of the community members out there. Thank you.
One thing I wanted to add was I feel like would be helpful if the community would let us know who is coming so we know we have a head count. So I'm preparing a few things to provide for lunch that day, but it would be really helpful. It would be really helpful if we had a number, if you could let us know. Thank you.
That sounds great, ladies. Yes, so what are the types of assistance that we offer? So some of the things that we can do is we can help folks if they need to stay home, if they're sick, we can help them get certain essential supplies, medications. We can provide masks, and we can provide follow-up testing. It's important to remember, though, that when you do get sick with COVID, you do want to schedule a follow-up with a doctor if it's not incredibly severe. If there is an emergency, if you or a family member gets COVID and you can't breathe, you have other very serious symptoms, you want to seek medical attention right away. And we also provide education and information on how to handle having a family member in the house that is ill and how to help prevent it from spreading from person to person. We're here if you have questions, if you have symptoms that you're not really sure what's going on. You're welcome to ask any of us, and if we don't have the answer right away, we'd be happy to find it for you. But I do want to emphasize, if you're feeling very ill, you're having trouble breathing or something, having trouble with vision or being steady when walking or standing, things like that need to be addressed right away. So it's a good idea to keep that on your mind, and if there are other questions that we can help you answer, we're happy to do that.
We could also, um, if you're experiencing any kind of emotional or psychological or mental health challenges as a result of either you or your family member contracting COVID, and you're having a difficult time managing that, and you need to be connected with services, we can get you connected with someone who can you can talk to, whether it's a therapist or someone from one of our community partners that can assist with getting you, providing you an opportunity to kind of navigate your way through the whole process, because having COVID or having a family member with COVID is difficult. It can be really difficult, and the mental health effects of this has is well known. And I think a lot of the community members aren't necessarily thinking that this is an opportunity for you to provide, or sorry, for you to seek out those services. But it is the perfect time, because while you have COVID, and then once you recover from COVID, there are a lot of questions, there are a lot of concerns, a lot of things that come up, and mental health services is a way that you can help, get yourself back on track. And there's a lot of services out there, from support groups to mental health services. Just contact us, call us on the COVID line. Let us know what you need and what you're having challenges with. If we can't help you right in front, we'll connect you with someone who can help you, because that is one of the most important things that people are dealing with COVID, but haven't had a true understanding of how to seek out those services. So we are a resource. We're not just a COVID response team. We are a COVID recovery team. Our job is to help the community recover from this pandemic and make people feel, more positive about how the future is going. So contact us at the COVID line. We'll connect you with someone who can get you some services if you need help. In addition to what Rebecca talked about, and helping you get groceries and things like that, or just having an ear to listen to. Sometimes we can do that for you as well. So I just wanted to throw that out there, because the behavioral health part is one thing that we don't talk about a lot, but we should be focusing on it because it is part of recovery.
That's right. It's really important. And COVID's a scary virus, so it's something to have to go through that illness, or have a family member going through that illness, or even friends, other loved ones. It can be really hard, and sometimes it's okay to ask for help. It's okay to have a shoulder to lean on. You just need to vent if you have frustrations and whatnot, and you just need someone to talk to. It's really important. Um, we're here for that. Um, something that they're still slowly discovering information about is long COVID. Folks that had COVID, whether they were symptomatic or asymptomatic, whether they were just sick enough to stay home and rest, or they were hospitalized. Folks are discovering that they've got some really intense long-term symptoms like that. We can help with resources and helping you adapt. If you need help you find mobility equipment, or even help coach you with some exercise if you're trying to get back to where you were before COVID, and you need some guidance. We're definitely here for that.
I just wanted to add also too that we can still make referrals to Buffalo Thunder if you need to isolate outside the home, and where you're monitored 24/7, and then meals are also provided for you. I just wanted to add that. Thank you.
So that's an interesting question. Tracking the demographics of folks who have been infected with COVID. There are definitely instances where we have, those age and comorbidities has been a very important factor in this infection. Troy, do you have anything to speak to on that?
Yeah, and one of the reasons why we keep track of the individual, we do keep track of people who we know have contracted COVID. There are some folks who have contracted COVID in the community that have not reported it, or we were not aware of it until after the fact. But we do keep track of the individuals who do test positive for COVID, their COVID vaccine status, what their all their demographics are, age, gender, all of that stuff. We keep track of it mainly because we want to know who we are helping. But like you're discussing the epidemic history, the epidemiological data that needs to be collected is important to kind of help us for the future. If we have any kind of public health crisis or infectious disease crisis in the future, how do we manage it? How do we protect those individuals who are most vulnerable? Those types of things. So we are keeping track of that information. How we put it together in a report, or how we kind of compile it, and when it's at the end, that's a whole nother story. We don't know exactly how we're going to do that, but we are keeping track of it. And so, with your question, Liana, that is still undetermined. We are still compiling information. We're going to have to go through the entire list of individuals who have contracted COVID from the time of from the beginning of the pandemic, and kind of get those percentages. But that is something that we can probably pull together and kind of determine and report that back to the community. But I think, um, you know, just to answer your question, we are keeping track of it to the best of our ability. And I didn't know if you had a reason for asking that. I just wanted to, if you had a reason or something that you're concerned about or you're thinking about that you need us to kind of address, just let us know and we'll try to get that information to you.
Well, these are all really great questions, and it might take some time for us to see patterns and trends that will um, help us understand this virus more, that help us understand how we can mitigate any future, you know, outbreaks or crises with this virus. So these are fantastic questions.
Well, I'm going to jump off. I'm going to go back to the conference and go talk to Randy Begay. She's over here also. So I'm going to let you guys finish, and hopefully you all have a good day.
Thanks so much, Troy. I really appreciate you popping up, and send Randy our best, Sam and I, and we'll see you soon.
Tomorrow, or maybe this afternoon.
All right. Just give another moment if anybody else has questions, concerns, suggestions. Well, in that case, I think we're going to wrap up today's COVID update. Again, I just want to remind you about the COVID hotline, 505-252-5986. Questions, concerns, and really, yes.
Just a reminder that we still are offering N95s. So if you need additional N95s, come on by and we will give you some. We also have children's N95s. So come by, and you don't even have to come in. We can just run outside and drop it off to you. So like Rebecca said, call the hotline and we will take that out to you. Thank you.
Thanks, Raylene. So we all want to stay protected and keep that number at 0. That'd be really great. But thank you, everyone, for coming and joining us today and asking really wonderful questions. Really appreciate you participating with us. and hope you have a wonderful rest of your day and week. We'll see you again soon.
Bye.